Good evening, sir. Metabolic syndrome and its association with mental health disorder in Indian patients. Whenever we talk about metabolic syndrome, it was very clear that it is a cardiovascular risk factor, independent of other. If you have constellation of syndrome and leading to cardiovascular disease, but whether it is associated with something related to mental health disorder, it was slightly bleak. We had spectrum of metabolic syndrome, but obesity definitely leads to mental health issues. Definitely. Diabetes, if there is comorbid issues, then it is definitely. But what about simple metabolic syndrome? That instigated us to do this type of study. It was a cross-section study done in more than 1100 patients. They were not patients, they were metabolic syndrome healthy persons, and it was very tough to include them in the study. 508 men, 595 women, various stages. We collected them, agreed them. They were having certain symptoms related to like anxiety, stress was there, but obviously they were having metabolic syndrome. 21 to 60-year-old, rural, suburban and urban, and it was very tough to call upon the rural population, but we included them, rural, suburban and urban, but maximum was on suburban. And metabolic syndrome was diagnosed as per NCP criteria, and we were not able to follow the criteria of Asian guidelines. But looking at the mental issue, I think there was not never considered that it will be influencing. But mental issues, it was, yes, cardiovascular issues that can be definitely changed when you look at the Asian criteria and Asian guidelines. But we continued with NCP. The results was that overall prevalence of metabolic syndrome was high, roughly around 25%, and it was highest in the suburban region. This is very, very important. If you look at the ICMR INDIAP study, the trajectory point also tells you it is around 20 to 35 age group, high trajectory. But suburban, they are specifically prone to develop metabolic syndrome, and they are highly prone to develop pre-diabetes and diabetes. So there is some different in comparison to rural and urban. So suburban very high. Similarly, if you look at the mental issues, depression, anxiety and stress, there was markedly high in suburban in comparison to rural and also in comparison to urban population. So that gave us something very important, that this is the target population where we should focus more. And these were the results, that looking at depression 2.54 odd ratio, anxiety 2.3, stress again 2.1, that was very high in suburban population. So conclusion was that metabolic syndrome is strongly associated with mental health disorder in Asian Indian adults, especially suburban region where it is the most prevalent. And these findings underscore the necessity for integrated public health intervention that addresses both metabolic and mental health. It has to be holistic management of diabetes, holistic management of metabolic syndrome, and holistic regarding pre-diabetes also. So further research is needed, and to elucidate underlying mechanism and design of targeted intervention to improve both physical and mental health of outcomes of the persons. Thank you.